Welcome to imPULSE 2.0, an ECG and chest pain competency series from Apex Innovations. We know you will learn better when you see, hear, and do. That's why we've built our courses with intelligent interactivity. imPULSE 2.0 is an always current online series that will increase your staff's knowledge of heart anatomy and physiology, ECG, rhythms, 12 leads, ACS, and more. This comprehensive series is comprised of 7 levels of interactive ECG and chest pain education and is the only program meeting all of the annual key educational elements required for accreditation as a chest pain center by the Society of Cardiovascular Patient Care. Level 1 expands knowledge by providing a visual and virtual educational presentation of heart anatomy and physiology. This educational experience presents anatomical structures of the heart with interactive 3D graphics and clear, easy-to-understand supporting information. You will learn cardiac physiology, including the cardiac cycle, circulation, conduction, and intrinsic pacemakers, and how to build a waveform, complete with on-screen calipers and waveform notes. Level 2 presents all things about electrocardiograms, starting with what an ECG is and how it is captured. Learn waveform and paper basics, counting methods, and waveform measuring. Take a quiz during the lesson to help reinforce knowledge, ensuring confidence and competency. You will learn anatomical landmarks and select and prepare electrode sites. Interactively place leads for a diagnostic 12, 15, or 18 lead ECG, or for a 3, 5, or 6 lead bedside monitoring ECG to learn correct placement based on current guidelines. After understanding the importance of accurate lead placement, learn to competently intervene in various ECG capture and interference issues. Level 3 delivers the facts you need to know about cardiac rhythms, starting from basic conduction and the normal waveform. Rhythms are addressed based on their region of origination and conduction. Additionally, rhythms are presented in defined categories based on specific characteristics, ultimately improving the understanding as well as recognition. Learn how to accurately and systematically review rhythms. Utilize floating calipers to examine the nuances of each rhythm, providing an interactive learning experience. Causes and interventions of rhythms also provide a valuable reference. Periodic quizzes are provided during the lesson to reinforce presented information and ultimately improve knowledge. Level 4 takes the mystery out of 12-lead ECGs and is the course you've been looking for. We begin with the basics. What is a 12-lead ECG? How is it captured? As well as when and why we perform them. Learn about ECG layout, waveform deflections, vectors, axis, and R-wave progression in a clear and concise manner. Become comfortable looking at the 12-lead ECG carefully and systematically. Zoom in on ischemia and injury in ST segments, as well as differentiate between old and new MI. Compare left and right bundle branch block while interacting with the content to view 12-lead waveform changes in each lead. Periodic quizzes are provided during the lesson to reinforce presented information and ultimately improve knowledge. Level 5 raises awareness of the standards of care for patients with acute coronary syndrome. This requires an understanding of pathophysiology, risk factors, symptom presentation, triage process, and treatments indicated. The importance of subtle waveform changes in the 12-lead ECG, waveform progression, ST segment monitoring, determination of old versus new MI, cardiac biomarkers, PCI, and fibrinolytics are addressed. It is critical for emergency professionals to be experts in early recognition and diagnosis of ACS, which will ultimately lead to timely intervention and positive outcomes when adhering to AHA/ACC guidelines. Level 6, there's no time like the present to learn about some very interesting advanced and special situations you may encounter in clinical practice such as heart disease, electrolyte imbalance, drug use, conduction disorders, and more. Our goal is to give you a focused overview of each condition, its causes, clinical findings, and expected ECG changes. Increase knowledge by examining the 12-lead ECG depicting these situations and use interactive tools to measure waveforms or compare to normal. Level 7 is a reference library filled with over 100 12-lead ECGs for practice and includes current guidelines, tips, and links. Thanks for watching this brief demo of imPULSE 2.0. If you would like to know more about this series, or if you're interested in reviewing all of the content of imPULSE 2.0, please give us a call.